I'm Petra. I'm the elective director for radiology, and I do a lot of the mentoring for students who are planning or considering going into radiology residencies. So I'm given some questions to answer here, and I'll try and answer them the best I can. We offer a variety of different electives in radiology, both for students planning to go into radiology and those who just want to get some training in imaging. For students who are going into radiology or considering it, we do offer 2 one-month electives in the end of the third year. We have one in September and one in November. And then there are 4 electives during the fourth year, which run in April, July, September, November. What we recommend generally to students who are undecided about a career, the best elective for them to take is probably one of the third year ones. So if you're strongly considering radiology, you've got a lot of other choices, you want to try it out, then do a third year elective. If you're very committed to doing radiology as a career, and perhaps you spent some time during the first and second year in radiology, then the best elective is really the July in the fourth year. By that point, students have learned a lot of medicine during the third year, and I think they get the most out of it, and we do some other stuff to help prepare them for radiology residency. So that's the Radiology 502 elective. That is our structured elective. It contains lectures, workshops, games. It's a lot of very didactic, focused teaching. We do offer a number of other electives during the year, such as subspecialty electives in women's imaging, neuroimaging, musculoskeletal, interventional radiology, and occasionally some other ones. And sometimes students do these who are going into related careers, such as OBGYN, for example. They may do the women's imaging one, but they're often ones that students who are applying to radiology will do in addition to the 502 basic clinical elective, and they tend to do these often in August or September, their fourth year, or if they're splitters, at some point during their time. Those have the advantage of giving you a little more focused time in that specialty area, plus opportunities to develop connections with the faculty in that area for developing research, for letters of reference, and so on. I do highly recommend that anyone who is even considering radiology come and meet with me as soon as possible during the third year. Then I can look at their total application, I can give them an idea how strong they are, or how likely they're going to radiology, and we've been extremely successful, touch wood. Everybody who's applied to radiology in the 14 years I've been doing this has matched. But there are certainly ways that we can help you develop your career, both through appropriate electives, but also through doing research projects with members of our department, or sometimes members of other departments. We also we do arrange some events, such as I have an annual Meet the Experts dinner at my house, where I get the matched fourth years together with any third years who are interested, for an exchange of information about interviewing and ERAS applications and so on. I have a question here. Does it make a difference whether a given student is very strong versus average or somewhat weak? Radiology is a competitive specialty. As these things kind of wax and wane through the years, I think it's not the most competitive specialty, but it's certainly going to be more competitive than some of the others, such as perhaps, family medicine or internal medicine, but it's not going to be as competitive as, say, orthopedics or dermatology or radiation oncology this year. So generally the candidates are strong. They generally have good step 1 scores. The average is about 245. But I have got many candidates into radiology with scores less than that. However, you have to be aware that if you have a significantly low step 1 score, or you have perhaps failed courses at a preclinical level, that certainly may impair your chances, and we'd have to look very carefully at application to see where we could help you improve in those areas. If you're really undecided what you want to do, I think splitting your 4th year is a great idea. Having had many 5th years going to radiology, and also having taught many 5th years in radiology who are going into other specialties, there is a significant difference in the knowledge bank and the maturity of those students, and it gives you the opportunity to not only explore a number of different specialties, but bolster your application by doing electives in areas like pathology, which can really help you in your future career. Students often ask whether they should go and do away electives at other institutions, and this is a difficult question. There are some institutions that let you do that, there are some that don't. That certainly can help you. It can also hurt you. We've had students come here who we might have accepted on the basis of a 30-minute interview, but after a month with us, we decided that they were not going to be suitable candidates. If you are very focused on going to one particular hospital because you have relatives there or a spouse who's going there, then I think in that situation it probably is worth it. If you have done our basic clinical elective, you don't need to do it to learn radiology, but you could go and do it to do a subspecialty area or some research time, and we've had people spend up to a year at other institutions doing focused research electives. What else here? In terms of an academic scholar year, the vast majority of students going to radiology have not done that. I think it's certainly something that can be a plus on your application, particularly if you're going into a very academic institution and that you want to do research, for example, long term. It's not something I would certainly say that you're required to do. Most students applying to radiology have 1 or 2 papers on their CV. Some have more, and many have none. So it's not an absolute requirement, but it's something worth thinking about particularly if you see yourself long-term being very academic. In terms of international rotations, the opportunities for global health and radiology are really just opening up. And so this is certainly not something that people have been looking at in applications on radiology residencies. It's an interesting field. It's something that we have people interested in here. And it's with the advent of teleradiology, it's now actually becoming something that one can really effectively do as a radiologist. So it's interesting, but I don't think it's something you're required to do. Oh, the best radiologists are the ones who know the most medicine and surgery. And so I would much rather, if a student in their 4 years has spent 2 months doing radiology, a general radiology elective and a subspecialist one or a research month, I would much rather they spent the rest of their time learning medicine and surgery. You need to know a lot of medicine and surgery. It really helps you immeasurably during your residency. It helps you immeasurably with your interactions with clinicians if you know what they're talking about. And so we generally do not recommend that people spend more than a couple of months unless they're splitting a 4th year and doing some research, for example. Do medicine, do surgery, do pathology, it's another good backup. But you don't need to do 7 months of radiology before you even go into radiology. We'll teach you that when you become a radiologist.